A lot of the world doesn't have access to the healthcare that we do in the United States, obviously. And one of the areas that's particularly lacking is optometric care, care for the eyes. And the reason is because most eye disorders aren't life-threatening. It's not like having malaria or having cancer that could kill you. But it really does affect quality of life. I mean, imagine if you couldn't see well enough to drive, or imagine if you couldn't see well enough to read a book or write your name. What effect that would have on you? Where would you be now? Would you be in the same place? And probably not. Most countries, however, aren't able to provide the optometric care that their population needs. So there are organizations from the United States that have gone out to provide this aid. We depend largely on donations, donated glasses. You may see when you go to your optometrist or when you go to a large store, a box that says, you know, donate your glasses here. Those glasses are all put into evaluated and put into our computer system so that they can be reused on appropriate patients. And then a number of people donate their time for doing the examinations to provide the patient care. Recently, I went on a trip with an organization called VOSH, Volunteer Optometrists Serving Humanity, where we took a number of doctors and a number of optometry students. And we were able to see a population of about 3,500 people who otherwise wouldn't have gotten optometric care in a period of about 4 days. So we intend to try to establish a permanent relationship with some of these communities to provide ongoing care and perhaps to address some of their more complicated problems beyond just the need of a pair of glasses. For example, problems with cataracts. So that's in the future, but we're very hopeful that we can continue to build this program. Other programs are doing similar things. There's a program called Fellowship of Christian Optometrists, which also sends out missions. There's a number of organizations, and these are based on the actions of dedicated optometrists or sometimes dedicated opticians or even people who have no optometric training but see the need, spending their time, their vacations, providing the materials, the equipment needed to do eye exams so that all this can be a reality.